In today's episode, I am delighted to be joined by Tania de Jong. Among many incredible accomplishments, Tania is the founder of Mind Medicine Australia, a charity that aims to expand the treatments available for Australians who are suffering from chronic mental illness through the safe and effective use of psychedelic-assisted therapies. In a world first, in 2023, Mind Medicine Australia successfully applied to reschedule psilocybin and MDMA so that psychiatrists with the requisite approvals are now able to utilise these substances for treatment-resistant depression and PTSD. In this conversation, we discuss the complex and political history of psychedelic-assisted therapies, current research and evidence, the types of mental health concerns and patients that would benefit from these treatments, and what the future might look like in this space. I think you're going to love this one. Let's get into it. So, Tania, thank you so much for joining us on the podcast today. I know that lots of my listeners are going to be so interested in what you've got to say. And what you've done is amazing with Mind Medicine Australia. But before we jump straight into that, I'd love to know a little bit about your personal story and how you came to create MMA with your husband.
Sure. So in a nutshell, I'm the daughter and granddaughter of Holocaust survivors. I was born in the Netherlands and went to school in Australia. And then when I finished school, I did a tennis scholarship in the US. I did a law degree at Melbourne Uni with honours, and I attended opera school at the Victorian College of the Arts. I did a diploma of opera and music theatre at the Victorian College of the Arts. And then I started my group, Potpourri, and we started performing all over the world. Subsequently, over the last, I guess, couple of decades or more, I've started 4 charities. So the Song Room in 1999, Creativity Australia and the With One Voice programs in 2008, Mind Medicine Australia in start of 2019, so we're celebrating our 5th anniversary, and the Umbrella Foundation, which I set up a couple of years ago to tell important stories that matter. So I guess my goal is around creating systemic social change, scalable change across systems that are generally dysfunctional, not working very well. My husband has also set up 2 charities, and I've always been interested in hacking mind, body and spirit. So singing has always been my drug of choice. I never got drunk. I'd never had any drugs at all until 2016, when I came across an article of Tim Ferriss around psychedelic-assisted therapies, which I had no idea what they were, what they did. I was naturally reticent because I've always been against drugs per se, and I never really understood the nuance of what is a medicine and what is a drug. And of course, it's all about how you use it and the purity of it and the setting and all of that and the dosage. But anyway, at the time, Tim Ferriss released a blog, and it was all about the fact that he was donating this $100,000 to Imperial College for a trial of psilocybin for the treatment of depression. And there was a link to an article in the New Yorker magazine called The Trip Treatment, which profiled patients going through an end-of-life study. And they all had terminal diagnosis of cancer with stress and anxiety, as you would have, of course, if that was the diagnosis that you have. And 80% of those patients went into remission after just 2 medicinal doses of psilocybin with a short course of psychotherapy. And one of them happened to be a man who had intergenerational Holocaust trauma. And so I was immediately like, wow, this is amazing, like how fascinating. I've tried mantra, tantra, yoga, meditation, cryotherapy, myotherapy, hyperbaric oxygen, everything you could imagine. And I find, lots of different modalities very useful because I'm a performer, so I want to be always performing and being at my best in life and being of service. And I think you can only be of service if you're really feeling whole and good about yourself. And so I just said to my husband, Peter, I said, I think we should do this. And he said, well, can you contact the researchers and get us into a trial? And at the time, there weren't any trials, and there are not many now for healthy persons, but certainly weren't many then at all. And so we met the researcher, but we couldn't get into any of the trials because we don't have a diagnosis that meant we could get in the trials. And so we ended up going to the Netherlands because we were introduced to a guide in the Netherlands, and we had a very powerful experience with psilocybin and really changed our lives in every single possible way. It was extremely profound. I mean, as you know, many people describe these treatments as these medicines as one of the top 5 experiences, the most meaningful experiences in their lives, and it certainly was that. And the sense of connection to self, to others, the planet, the oneness, the way that I've never seen nature the same again, a leaf, a flower, a seashell, a cloud, anything in nature looks entire flower, it looks entirely different since that day. And so it was a life-changing experience. It took us a year to integrate that experience, and we went back and had a second one even stronger. And after that, we just went, wow, well, if this is helping us like this, what could this do for all the people and the charities that we have set up? Most of whom might be suffering with unemployment or homelessness or depression or loneliness or disability or whatever it might be. But mostly underpinning those sorts of disadvantage and suffering is mental illness of some kind, anxiety, depression, some kind of addiction, or a mix of all of the above. And so we then started traveling all around the world, meeting leading researchers in the field, attending events. I started speaking at some events and singing at them because I'm a singer, as you know. And then in 2018, we decided that we were going to start Mind Medicine Australia to build the ecosystem for these treatments to become available, accessible, affordable in Australia to those who needed them the most. And so we launched Mind Medicine Australia in February of 2019. We had a big launch. It was immediately, we galvanised a lot of support right up front. And then we started putting in applications to the TGA for the rescheduling of psilocybin and MDMA, which are the 2 medicines that are most advanced in this field. MDMA-assisted therapy to treat post-traumatic stress disorder and psilocybin-assisted therapy to treat depression. But these medicines are also being trialled for a whole range of other conditions, including addictions, obsessive-compulsive disorder, anorexia and other eating disorders, Alzheimer and other cognitive decline, Parkinson's, stroke, fibromyalgia, cluster headaches, autism spectrum disorder. I mean, there's a lot of there's a lot of different conditions that potentially could be treated by these transformational medicines. It's important to say, for those of you thinking psychedelics, these medicines have actually been with us since the beginning of human civilization. So the ancient medicines, particularly the psilocybin and many plant medicines have been informing human civilization since the very beginning. They've been with indigenous cultures from the beginning, and they're still used for religious ceremony, for raising of consciousness and healing in many indigenous countries and cultures around the world. For example, in Peru and many parts of South America, they're legal. Psilocybin truffles are legal in the Netherlands and in Costa Rica and so on as well. So there are a number of countries that recognise these substances and don't try to criminalise them. And they were criminalised in 1970 in the War on Drugs, which was a political event. It had nothing to do with the science, and it censored the research and use of these medicines for the past 50 years nearly. But as you know, Australia became the first country in the world to reschedule psilocybin and MDMA last year through the work that we did. And the first 2 patients, in fact, got treated 2 weeks ago in Melbourne.
Yes, and that's because there's a funny rule in New South Wales that you can only be treated in a hospital. Is that why it had to happen in Melbourne?
Yeah, no, that's entirely different in Melbourne. So what actually happened was the New South Wales psychiatrist, his patient from rural New South Wales, and the psychologist from rural New South Wales all had to fly to Melbourne to give this treatment, which is quite ridiculous because, of course, these treatments do not have to occur in mental health hospitals, and they rarely do. And thousands of patients who've been treated over, this renaissance in the research, and also in the 50s and 60s, tens of thousands of patients were treated in clinical environments. And there's no research that suggests that treating someone in a mental health hospital is better or safer than in a clinic. In fact, most therapists would argue, and the patients too, that it's much more comfortable to be in a clinical environment than in a hospital environment where the patient can feel at ease, build that rapport with their clinician without being intimidated by a hospital environment, and actually have a very beneficial experience. So the New South Wales government are being very short-sighted right now, because at the moment anyone in New South Wales has to go to Victoria or Queensland to have these treatments. I'm sure this will change, and certainly if a number of your listeners and yourself and others put pressure on the New South Wales government, they will have to change this, because it's unethical to withhold these treatments further from people who have no other treatments available to them. And this is the thing we need to remember, is that many patients are treatment resistant, and that current treatments, in the case of antidepressants and psychotherapy for depression, about 15% of patients go into remission from existing treatments for depression. And there's major side effects for many antidepressants for many patients, and it's difficult to withdraw from those antidepressants. In the case of post-traumatic stress disorder, as few as 5 to 10% of patients are going to remission from existing treatments. So we're not getting the majority of patients well, whereas with these treatments, these psychedelic-assisted therapies, we're seeing remission rates of 60 to 80% after just 2 to 3 medicinal treatments with a short course of psychotherapy. Now, think about all our family members, our workplace colleagues, people in the community who are suffering, who could be well and leading meaningful, healthy, happy, contributing lives, which is everyone's birthright if they get access to these treatments. So certainly if someone's been treatment resistant to one or two other treatments, they should be getting access to these treatments, provided that they're a suitable candidate for these treatments. And as with any medicine, and this is the important thing for any doctor to remember, is, there needs to be proper screening. There needs to be full disclosure on the risks and benefits of all kinds of treatments, and the patient needs to provide informed consent. And if those things don't happen, then basically the patient is being administered with medicine that is not that they've not fully consented to. So I know a lot of people, for example, who get given antidepressant scripts, but they've never been told about the side effects by their doctor or how difficult they are to withdraw from. And that's not okay. Just the same way as it wouldn't be okay if a doctor didn't fully explain how psychedelic-assisted therapies would work to their client and what would be the risks and benefits. That being said, the risks of psychedelic-assisted therapy under the treatment of professional therapists are minimal. The worst that someone may feel is like a headache or some nausea. There has never been a serious adverse event associated with these medicines, provided that patients are screened properly, which is the doctor's job to do for all medicines and all treatments. So
it's been said that this is one of the biggest breakthroughs in psychiatric treatments, and certainly as a GP with a really big interest and big caseload with people with very chronic mental health problems. I think this is, really actually exciting, and it's sort of frustrating when you delve in and see the history and the fact that actually in the 1970s, there was such great research that was really already pointing in the direction of this being very helpful. And it's hard not to feel frustrated that there's been lots of lost years where potentially people could have been helped. All that aside, we can't go back in time. I suppose my next question would be for you is how can we make this available to people who don't have lots of money? That seems like it's going to be potentially a little bit of a challenge, given that you need quite intense psychotherapy and things. I'm sure you guys have thought about that.
Oh no, we have. I mean, we're doing everything we can. I mean, this is all fairly new at the moment, but Mind Medicine Australia has started a patient support fund, and we invite everyone who's listening to your podcast to make small and large donations to that fund, because we've already had quite a few people apply to that fund, who are qualified patients to get these treatments. In addition to that, we're in discussion with various health insurers who are very interested, obviously, in being first movers in this space. And also, I believe that through Medicare, some of the therapy, which is the main cost. So one of the things that Mind Medicine Australia has done is we've done a deal with a Canadian supplier for the medicine. So the medicine cost is negligible in the treatments. So you're seeing costs probably of $15,000 to $20,000 for a course of treatment. That's what's been stated for a 3-month course of treatment. Now, of course, if you compare that against the lifetime costs for a patient who might be suffering terribly and who never gets better, so let alone their pain and suffering, but they may be taking psychiatric medicines and having to see therapists for the rest of their lives and still not becoming well, those costs are going to be far in excess of the $15,000 to $20,000. And in fact, in the US, there's been some economic modelling done that shows that patient savings will be at least $100,000 across the life of a patient. And that was a few years ago, and I imagine that that has probably increased, so the patient savings will be even higher now. But even without that, I think, from what I've heard, the cost of the therapy, like any psychotherapy, will be, some of that will be rebatable through private health funds and through Medicare. I'm fairly sure. I don't know how much, and I guess it will depend on each person's plan and what kind of insurance they have and so on. But I think over time, and it's very likely that MDMA will become prescribable in the US this year. And when it becomes prescribable in the US, it will become prescribable in Australia as well, and then it will go onto the PBS as well. But as I said, it's not the cost of the medicine that's the main.
It's a psychotherapy element. Yeah. And Tania, I appreciate you're not a clinician, but you're obviously extremely knowledgeable. What does the protocol look like if for a patient? What's involved? How long does it take? Can you tell us a little bit about that?
Yeah. Yes, very well. So firstly, obviously, there's a screening that we spoke about earlier. So it's really important that you screen your patients. And of course, as a GP, Shauna, I mean, we're having a lot of GPs who are doing our certificate in psychedelic-assisted therapies, which is a world-leading course. We have a global, amazing faculty with people like Dr. Gabor Mate and Bessel van der Kolk and many others on the faculty.
Oh, I've looked
And
into it. I've been having your emails for the last 5 years.
look, please do the training. You sound perfect to do it. We've got lots of GPs doing it, because GPs at some point could become prescribers in this space too. But a lot of GPs that we know are working out referral pathways with psychiatrists in the course, and so there's a lovely synergy happening. But I guess so there's the screening that we spoke about before. So screening your patients, ensuring that they're suitable for the treatment, talking about what's going to happen in the treatment as much as you can. I mean, these experiences can often be a bit beyond words. But, just making the patient feel comfortable, setting intention for the ceremony or experience. I call it a ceremony because there is something sacred about this. These are sacred medicines.
Say setting an intention. What do you mean by that, Tania?
So not too specifically, I always say, but if you want, it might just be, I would like to achieve whatever healing is possible for me at this time. I would like to be shown whatever is I need to see, or deal with. So it might be anything like that. I think it's always good not to be too specific, because Generally, people say, the really wise shamans and the wise leaders who've worked with these medicines here say, the medicine gives you what you need, not what you want, right? And so, really, it's all about just accepting what is that's coming through the medicine, whatever you're being shown or you're feeling or you're experiencing, and accepting that and going towards it. And sometimes you'll see some things that are dark and that you might be a bit afraid of, but as you go towards them, they'll inevitably vanish. And it's a really important lesson about, whatever's in the way is the way, so just coming to terms with your fears, facing your traumas, facing into your trauma rather than away from them. So it's the opposite of avoidance. It's sort of the opposite too of an antidepressant, which tends to numb out, the highs and lows of human emotional experience. And it's really just facing into what has been and accepting what has been, not forgetting it. I mean, we can never forget some of the things that we've experienced or seen or that have been done to us. But it is about saying, okay, that happened, but I'm not going to continue to bring the past into the present to destroy this present moment. And so what we find is that through bypassing the default mode network of the brain, which is what keeps us stuck and defaulting into the rigid, stuck thought loops, I'm not good enough, things won't work out, the things that people with depression will often say, so that these loops actually stop being so stuck, and we start to see this incredible neurogenesis occurring in the brain, this increased neuroplasticity, the reconnection of multiple different neural connections and neural pathways forming. And it's through that then the therapist gets this incredible window of opportunity to start to really fast track with their patient the healing process. So that's why Dr. Ted Cassidy, one of the psychiatrists who treated a patient 2 weeks ago in Australia in Melbourne, said he achieved 1 year of therapy in 1 day with his patient.
That I thought that sounded absolutely amazing. And I think he also said that previously his patient only would talk in very general terms about her trauma, but afterwards was actually finally able to really open up about what had happened and allow them to move forward. So it's nearly like helping people actually open up and then be able to move beyond where they're been stuck for a long time. Is that kind of the idea?
Yeah, totally. So, that's what we're seeing is we're seeing this like incredible. So, people generally, if they're suffering with depression or anxiety or addictions or whatever, are often very stuck, very disconnected and separate, feeling separate and isolated. And as I mentioned before, one of the things that the medicines do is they really reconnect you to yourself, to others, and to nature and so on. And that provides this extraordinary healing opportunity, which is why the healing process and what we're seeing in terms of the remission rates is so profound and so different than what the other treatments are like that we have. Oh, and then, sorry, just to finish that. So the patient then goes through a medicine session with the therapist, and then integration sessions. So it's really important that the patient integrates what they've experienced, which could be insights about their life, their work, their relationships, and that they start to make the changes necessary so that they're not just walking back into their lives that they had before, that they're actually empowered and feel like, okay, now I'm going to make these changes because I don't want to be that person anymore. I mean, I know lots of people who've given up alcohol as a result of having psilocybin. They just saw themselves and decided that wasn't them anymore. And literally, they stone cold stopped drinking alcohol after having psilocybin. I know people who stopped smoking as a result of that as well, and other drugs too. So, and then what happens is that cycle continues. So, depending on how many doses of the medicine you have. So, in the case of MDMA assisted therapy, at the moment it's 3 doses that you would have, but they're all buffered by these integration sessions. And the same with psilocybin at the moment, 2 sessions.
And do you know how they decide whether you're best to have MDMA or psilocybin?
Yeah, I mean, it depends on your diagnosis. So, in general, at the moment, MDMA assisted therapy is more indicated for post traumatic stress disorder, CPTSD as well, generalized trauma. And of course, it's being used for addictions. Psilocybin is also being used for addictions, but it's particularly indicated for depression, which is sort of, that more stuck form of thinking that we were talking about just before. And of course, now it's starting to be used for OCD, another very stuck and rigid form of thinking for anorexia and eating disorders. These are all very stuck, conditions. And if you can unstick those rigid loops and give that patient that window of opportunity, that flexibility where they can start to really heal, then you get magic happening.
So, like yourself, and I'm sure people listening, a lot of people are sort of hesitant and a little bit anxious because for years we've always been told that these drugs are bad and dangerous, and people take them at festivals, and you hear of people being carted off to the hospital. And so, I think just to make it clear that we're not encouraging people to take this is all very much in a very controlled environment, given in a kind of medicated form in a tablet where the dose has been set, and then you're very much following a very prescribed treatment. Isn't that right?
Yes, so the patient never gets to take the medicine home. Very important to say that. So it's not like medicinal cannabis, where in fact, I mean, you can get quite high on THC, for example, which you can take home. Um, but in this case, you're under the care of two therapists during the actual medicinal sessions. You never get to take the medicine home. And then you have a course of psychotherapy, which you're working, I guess, with the therapist hand in hand for your healing process. And it's very important to say that we at Mind Medicine Australia do not promote recreational use of these medicines. And there's multiple reasons for that. There are some very good underground practitioners, I should say that, but we don't encourage people to go underground because you just don't necessarily know the quality of who you're working with, and you really need to do your due diligence if you're going to do it. And we certainly do not recommend people go out and pick mushrooms unless they really know what they're doing, because there's just too many accidents with that where people pick the wrong ones, and you know that could be an absolute disaster. Um, so
Dosing seems to be something that people are talking a lot about. Do Mind Medicines Australia have thoughts on that?
So we're not focused on microdosing at Mind Medicine Australia. However, that being said, microdosing can be very, very effective for patients wanting to taper off their antidepressants. And I certainly know of a lot of people who have used microdosing to come off antidepressants. So they've been able to taper off their antidepressants through the microdosing, and some of them have just become well through microdosing. But in many cases, they've used the microdosing so that then they can have the full medical dose, because it's important to say that you will not have much experience with the psilocybin if you're on antidepressants, because they're numbing out those receptors, so that the medicine simply will not go into the 5T2A HT2A receptor. It will not go in there if you're on antidepressants. So with your doctor, you need to work out a way of tapering off your medication. Now, in the case of MDMA assisted therapy, I'm not sure. There are some contraindications, definitely, but I don't know if antidepressants are contraindicated for MDMA. So I'll have to check that. But in general, you need to check all these sorts of things. Your medical professional should know these things. And certainly the people doing our course know what the drug interactions are.
So you guys have made incredible headway in actually what feels like quite a short period of time. I know you guys have been just so industrious and lobbying to get these changes. What barriers do you think there still are in place before we sort of see this being rolled out, and people being able to kind of book in and have it done?
Yeah, I mean, there definitely are barriers to that at the moment, in terms of the fact that it's just psychiatrists who can become authorised prescribers. So that's obviously a barrier, because firstly, most psychiatrists' books are pretty full, but the psychiatrists that we're training have all worked out ways that they can screen patients, and then other therapists in their multidisciplinary team are doing the actual treatments. So that is the way to sort of speed up the actual treatment process. And in general, psychiatrists will not be sitting with patients doing the full treatments. It would become far too expensive. And they've already got big lists of patients to see.
And not enough of them in Australia as well.
Exactly. And so I guess, over time, I mean, I think if you work with your colleagues in the GP world, I think all of you could effectively lobby, to become. I mean, firstly, I think GPs need to work with RACGP and just get them more interested in all of this, and some of the other professional bodies like the AMA and others to really get those organisations on board. I guess, we're training as many people as we can. And of course, by the end of this year, there'll be 500 trained therapists through our certificate in Australia. And that course is recognised by the TGA as a legitimate training for this treatment and these therapies. Other barriers, we've overcome a lot of barriers. There was a lot of stigma and prejudice. A lot of that is gone now. There's still a lot of people in the medical profession, I would have to say, who need to do more homework on this field. They need to do their homework like you would on any treatment and learn about it without sort of dismissing a treatment that might be the only treatment that might get a patient well, especially if they've tried everything. I think that the cost, as I've mentioned to you, but those barriers will gradually decrease, and as health insurers come into the frame more, I think the treatments will become more affordable as they become prescribable medicines, which will occur. That will help as well as they come onto the PBS and that sort of thing. And I suppose just the other thing, we get asked this all the time, is that there's just a lot of people who would like to experience these medicines who are not really sick. They're people like us who just want to grow personally and want to, be in touch with different dimensions of consciousness and raise consciousness and, feel more whole in whatever that means, bringing all the parts into the whole. And I certainly hope that people will get the chance to get access to these sorts of treatments in retreat environments and other environments that are not illegal over time, and that they can start to really access these experiences. But we know anecdotally and through a lot of research that's being done that there are gazillions of people who are using these medicines in the underground for mental health issues. They're not just using them for fun. They're literally using them to heal their lives and feel better. And yeah.
Tania, I know you guys are obviously really supportive of research and development, and I know that Imperial College in London and Oxford University and Johns Hopkins in the US and Stanford are all like really, really active in research in this space. Do we have Australian universities on board?
We do. So Mind Medicine Australia helped advocate for a federal grant of $15 million that was released a couple of years ago that's funding 7 trials around Australia. And we are, Mind Medicine Australia, outside of government, is the largest funder of trials in Australia. So we're currently part funding 4 trials in Australia as well. And there's a number of trials going on in Australia at the moment.
And do you know when any of them will be sort of going to publication?
A lot of the trials, not all of them, but many of the trials going on in Australia are replicating trials that have been done overseas, which is not something, by the way, that we would fund because we're interested in novel research, and we don't see a point in replicating research that's been completed overseas. We consider it a waste of resources. But in terms of some of those newer trials, for example, we have a healthy persons trial going on at the moment at ANU for practitioners who've done our training, and they can trial MDMA or psilocybin assisted therapies with 6 therapists in the room at once, 6 of them.
Oh, wow.
I know, it's pretty amazing. And then they have like ECG or some kind of brain measuring tool on at the same time. So this would be like, I can't wait to see the results of that one. Yeah, and I think we have one I know there's one going on at the moment for OCD. Um, there's there's a number of different trials going on in Australia. I think we have a list on our website, mindmedicineaustralia.org. We keep up to date of all the different trials that are sort of taking place and that sort of thing.
So I know you're on a time frame, so
Yeah,
I'm going to just very quickly finish off if that's okay.
sure.
I'd love to know if you have a piece of advice for your 20 something self.
Huh. Well, a piece of advice would have been I wish that I would have had access to these treatments when I was in my 20s, because I think it would have made my life, if I'd done them in an intentional way, not just at a rave party or something, but if I'd done them intentionally, which I probably would have because I was that sort of studious sort of person, and I would never have taken drugs frivolously. Um, I think it would have helped my life be less painful. I think that I would have suffered less, and I would have probably been an even better leader. And I think I would have learned some of the lessons that I've learned more recently earlier. And I think that would have been, yeah, I don't know how life would have turned out. But, I don't have any regrets, I guess. Life is what it is. And I accept everything that I've had. And I guess I always believe that we go through these dark nights of the soul to learn and to heal further and to become more of who we are. So there's always hope in adversity, and there's a silver lining. And we should never see our suffering as something that is insurmountable. There's always, if you ask for help, it's amazing how people will come and support you and help you. And
Do you
um,
still feel like you
yeah.
can still feel the impact of the treatment that you underwent in the Netherlands? Do you still feel it's having lasting impact on how you live your life now?
Yeah, I mean, I probably have continued to have um, intentional medicinal sessions at least once a year ever since then, once or twice a year. Um, and I find that really good just to remind me what really matters in life, and also just the eternal nature of our souls and our spirits. That's something that the medicines really, there's a real mystical peak experience. If you're lucky enough to have an ego dissolution with these, particularly with psilocybin, um, you start to really see that you're part of something much bigger. And then some of the small sort of things that used to get you down, you sort of realize just how immaterial they are compared to what really matters in life. So, yes, I would say that my life has never been the same again since that day in 2016. And I've also had other experiences since then that have, well, Aldous Huxley famously said, once the doors of perception are opened, they never shut again. And so, in the doors of perception. So, I think once you open the veils to different altered states of consciousness, they won't close again. And you can continue to access those different levels of consciousness in meditation and other, like I do in my singing even more now, and just other activities that I do. It could be climbing a mountain or going into nature, where I suddenly become very conscious of what I felt that day. But it's just now part of me. It's and that's a great medicine, you know.
So, obviously, your website, Mind Medicine Australia, is full of very helpful resources, both for doctors, psychologists, but also there's lots of information on there for patients. Is that
Yes. Yeah. Yeah. I mean, there's an enormous amount of resources there. We've got a whole learn section. Just go in, explore. There's videos, there's articles. If you're a patient, you can put in a form. If you're a therapist, you can obviously apply, or doctor, you can apply for the certificate in psychedelic-assisted therapies. We also run an incredible free global webinar series with people like Dr. Gabor Mate and Bessel van der Kolk and Gabor Mate. Oh, sorry, I said that already. And Wade Davis we just had last week, and Rick Doblin and David Nutt. We have like all the leaders, sort of people in the world, doing our webinar series. We have a book of the first Australian healing stories, 32 Australians who healed through these medicines. We have lots of resources. A podcast series, yeah.
Amazing. And I know you don't have a crystal ball, but where do you think we're going to be in 5 years' time here in Australia?
I think, a lot more people, like, I think this week or in the last little while, the millionth prescription of medicinal cannabis was achieved. And that's after not many years. And yes, the patient gets to take it home. It's a different form of therapy. But I think we're going to see a progressive increase in patients being treated. And as I said, I hope that over the coming years we'll see more retreats and places where people can actually biohack and, and microdose and do all of that, which they're already doing anyhow. So it's sort of like there's no point in stopping any of this because it's happening. So we might as well just allow it. And I think that's the great thing about a country like the Netherlands is so progressive. It's sort of like, well, why would we stop this? You know,
So basically, my understanding is, these medications got moved from being a Schedule 9 to a Schedule 8. And Schedule
yes,
9 means that something has no therapeutic value as a medication.
yeah,
So it is actually amazing and great that they have been moved schedule, because it opens up that ability to actually investigate where we can go with these therapies.
totally. I mean, it's just so important. And to suggest that these therapies have no value, I mean, that was all a political, machination of Nixon, Richard Nixon, who basically lied about the therapies. His advisors even acknowledged that in writing and prohibited the use of these substances back in 1970. And as you say, there has been all this lost time, one can only imagine. But we are where we are. Thank goodness there has been this renaissance. There's some extraordinary researchers and leaders in the field all around the world, incredible clinicians, caring clinicians who want to get their patients well, and an enormous body of patients who want to lead meaningful lives and deserve just that. So let's all work together and make that happen.
Yeah, amazing. I think, one of the things about mental health is that people struggle with chronic mental health for years, and really they're sort of just pushed to the side, and they, move from one therapy to the next, or sometimes they don't. They're just stuck, really not living in any way kind of a life, because they're just so stuck. And I think it's going to be really interesting to see how that whole thing changes over the next sort of 5 to 10 years. I think it's going to be pretty exciting, actually.
Absolutely.
If you enjoyed this episode, I'd really love you to leave a review or share with someone who you believe would benefit from hearing this conversation. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.